Bismillahirrahmanirrahim. Today we shall discuss the topics of drug abuse and drug dependence and drug addiction. Let's first of all see what these terms mean. The word drug is defined as any substance that, when taken into the living organism, may modify one or more of its functions. Drug addiction is a state of periodic or chronic intoxication detrimental to the individual and society, and it is produced by the repeated intake of some habit forming drugs. Drug abuse, on the other hand, is defined as a self administration of a drug for non medical reasons in quantities and frequencies which may impair an individual's ability to function effectively. Drug dependence is described as a state, as psychic and sometimes also physical, resulting from the interaction between a living organism and a drug. The various things that are considered responsible for drug dependence are curiosity and natural tendency to experiment with drugs, or disturbed home environment, children from broken homes, indifferent parents, lack of communication between parents and children. Another factor is an escape phenomenon from tensions and frustrations in life, for example, failure in examinations or unemployment. Impact of modern culture, mobile, TV, internet, etc. is another factor. Ignorance regarding the habit forming nature of the drugs is another factor which may be responsible for drug dependence. A person is said to be a drug addict when he fulfills the following criteria. The criterion includes, first of all, psychological dependence. There is an overpowering desire, in fact, a compulsion to take the drug and obtain it by any means. Then, physical dependence. When the drug is withdrawn, the patient shows withdrawal symptoms. And the third is a development of tolerance. There is a tendency to increase the dose of the drug which that person is taking. Symptoms of drug addiction include loss of interest in sports and daily routine, loss of appetite and body weight, unsteady gait, clumsy movements, tremors, reddening and puffiness of eyes, unclear vision, slurring of speech, fresh and numerous injection marks on body and blood stains on clothes, nausea, vomiting and body pain, drowsiness or sleepiness, lethargy and passivity, acute anxiety, depression, profuse sweating, changing mood, temper tantrums, depersonalization and emotional detachment, lack of empathy or a state of apathy, impaired memory and concentration, and presence of needles, syringes, and strange packets at home. The agent factors which are responsible for drug dependence and drug addiction are, first of all, the dependence producing drugs. A dependence producing drug is one that has the capacity to produce dependence upon itself. And some of the drugs that are dependence producing are alcohol, opioids, cannabinoids, sedatives or hypnotics, cocaine, caffeine and other stimulants, hallucinogens, tobacco, some volatile solvents, and some other drugs as well, which are psychoactive substances. So apart from dependence producing drugs, there are certain drugs which are non-dependence producing, and the drug dependence or drug addiction or drug abuse of these drugs may also happen. And some performance enhancing drugs, especially among athletes, they are also responsible for drug dependence and addiction. So let us look at some of the drugs which are commonly abused. These include amphetamines and cocaine, first of all, then barbiturates, cannabis, heroin, LSD, alcohol, tobacco, and some volatile solvents, for example, glue or petrol, etc. Host factors which are responsible for drug dependence and drug addiction. These include one's desire to experiment with drugs, or one's sense of adventure, or desire to seek pleasure, wish for self-knowledge, and desire to escape. And more people are using drugs even to escape minor discomfort, and many of them have shown symptoms of social and psychological maladjustments, and that can lead them to drug abuse and drug dependence and drug addiction. The average age of drug users is decreasing day by day. Multiple drug use has also become more common. In countries with long experience of heavy drug use, there is tendency to prefer a single drug, perhaps because a continuous supply is less problematic. Environmental factors include unemployment, living away from home, migration to cities, relaxed parental control, alienation from family, early exposure to drugs, leaving school early, broken homes, single parent, large urban environments, areas where drugs are sold, traded, or produced, certain occupations, for example, tourism, driving, etc. Areas with high rates of crime or vice, areas where drug using gangs are present, and areas where delinquency is common. Alcohol is one of the commonly abused drugs, and its abuse is widespread almost throughout the globe. By pharmacological definition, alcohol is a drug and may be classified as a sedative, a tranquilizer, hypnotic, or anesthetic, depending upon the quantity consumed. And of all the drugs, alcohol is the only drug whose self-induced intoxication is socially acceptable. And over the years, the increasing percentage of young people have started to drink alcoholic beverages, and worldwide, an estimated 2.3 million people die from alcohol-related causes every year. WHO has estimated that there are about 2 billion people worldwide who consume alcoholic beverages, and as a result of intoxication due to alcohol, unintentional injuries, and suicides, these account for a large number of deaths. So alcohol has an effect on the central nervous system. It was considered a stimulant, seen as a stimulant previously, but that is not the case. And the research has proven that it is actually a depressant, and it produces psychic dependence of varying degrees from mild to strong. And physical dependence develops slowly. According to current concepts, alcoholism is considered as a disease, and alcohol is considered as a disease agent, which causes acute and chronic intoxication. And it is also said to be associated with cancer of mouth, pharynx, larynx, and esophagus. It is also an important etiological factor in suicide, automobile and other accidents, injuries, and deaths due to violence. The health problems which are associated with alcohol are only part of the total social damage, which includes family disorganization due to alcoholism, crime and loss of productivity, etc. Tobacco is another drug or drug containing agent whose abuse and dependence is widespread in the world. It is in legal use everywhere in the world. It is not illegal anywhere, and it causes far more deaths than all other psychoactive substances combined. It is responsible for about 30% of all cancer deaths in the developed countries. More people die from tobacco related diseases other than cancer, such as stroke, myocardial infarction, aortic aneurysm, and peptic ulcer. Young people who take up smoking have been shown to experience an early onset of cough, phlegm production, and shortness of breath on exertion. There is evidence that the earlier a person begins to smoke, the greater is the risk of life-threatening diseases such as chronic bronchitis, emphysema, cardiovascular disease, and lung cancer. Experimentation with smoking as a symbol of adult behavior is common in adolescence. It is suggested that three factors are associated with young people smoking. These factors are peer pressure, second one is following the example of siblings and parents, and third one is employment outside the home. If a child's older sibling or both parents they are smokers, the child is 4 times as likely to smoke as one with no smoking model in the family. In developed countries, the consumption of tobacco is decreasing, but in developing countries or underdeveloped countries, the consumption of tobacco is increasing. Because of the long delay between cause and full effect of tobacco and its associated complications or diseases, people tend to misjudge the hazards of tobacco. When a generation of young adults begin to smoke, they do not witness the high morbidity and mortality associated with their behavior until they reach middle age. Women smokers are even at greater risk of having the diseases associated with tobacco use. The adverse effects of oral contraceptives, for example, are markedly increased in women smokers. Osteoporosis is accelerated with tobacco use. There is some evidence that indicates that fertility is also impaired with smoking. Tobacco use is also associated with the higher rate of spontaneous miscarriages. In pregnancy, smoking contributes to perinatal complications such as bleeding, which is dangerous for both mother and fetus, especially in poor countries where health facilities are inadequate. Intrauterine growth retardation and low birth weight babies are known outcomes of smoking during pregnancy. Passive smoking or secondhand smoke is nearly as dangerous as active smoking. Secondhand tobacco smoke is the combination of smoke emitted from the burning end of a cigarette or other tobacco products, and also the smoke exhaled by the smoker. It harms the non-smokers as well, and there are studies which have proven that lung cancer in passive smokers is much higher than non-smokers, and also many other complications, for example heart disease and stroke, etc., is also associated with secondhand smoke. Then there are smokeless forms of tobacco which are also used, especially in our part of the world and in Southeast Asia. And these include pan masalas and gutkas and suparis and naswar and a thing called kheni, etc. And these are more prevalent among men than women in countries of Southeast Asia, except in Bangladesh, where women use more of smokeless tobacco than men. Next, we move on to the prevention strategies for drug abuse and drug dependence and drug addiction. Certain occupations and areas which are related with high crime rates and drug gang related areas, these must be the focus areas for prevention. And approaches to the prevention of drug dependence should have realistic aims. The first approach is legal approach. In this approach we go for legislation and make the availability and use of certain drugs as difficult as possible. Legislation restricting or prohibiting advertisement that directly or indirectly promotes the use of tobacco and alcohol has been increasingly common in recent years. The anti-smoking measures which are suggested are, and these are very important, first of all, the prohibition of the sale of the tobacco products to minors. Second one is the restriction on the sale of cigarettes from automatic vending machines. Third is prohibition of smoking in schools and other places frequented by young people. Fourth is prohibition of smoking in public. Fifth is prohibition of cigarette advertising at times and in places and ways calculated to ensure its maximum impact on adolescents. Next is establishment of mandatory public health education on health consequences of smoking. And lastly, the insisting on the placing of mandatory health warning on cigarette packets. So these are the measures which are anti-smoking measures which can be adopted by legislation and which can be very effective. The minimum age at which minors may legally have access to alcoholic beverages has been raised in some countries, and there is also legislation controlling the distribution of alcohol in some countries, and mandatory jail sentences for drunken driving are also there. Another approach for prevention is educational approach, and the prevention of drug use and drug related problems can be done by adopting educational approach, and the message that you want to convey through educational approach should be clear and unambiguous to the intended audience and come from credible source of information. The message should also provide specific advice rather than general, and as far as possible the information should be new to the audience and should be capable of provoking discussion or action. To be effective, such approaches should be regarded as a part of integrated plan of action involving other strategies. Another approach for the prevention of drug dependence and drug addiction is community approach. Interventions in the community that bring preventive action to the level of people and people's everyday lives. These are very important. Action at the community level is also important since communities often bear the main burden of dealing with the harmful use of drugs, since a rise in crime and other things that affect the community also increase with the increasing drug use and abuse. Popular approach to the prevention of drug abuse is provision of alternative activities. For example, teen centers that may have activities including the establishment of groups or organizations interested in athletics, sports, music, etc. NGOs have a crucial role to play in community approach as well. Treatment for drugs cannot take place until the individual attends for treatment. He must come to terms with the possibility of a life without drug taking. Unfortunately, drug takers, as a rule, have little or no motivation to undergo treatment. Alcoholics tend to deny that their consumption is abnormal. Others openly defend their habits. The drug addiction may be considered as a social problem. The first step in its management is medical, though, and it includes identification of drug addicts and their motivation for detoxification or detoxification. It requires hospitalization and then post detox counseling and follow up. Simultaneously with medical treatment, changes in environment, for example, home, school, college, social circles are also important. Psychotherapy has a valuable place in the management of addicts. Finally, post-treatment rehabilitation of drug addicts or drug abusers is very important. The rehab of former drug users, regardless of age, is in most cases a long and difficult process, and relapses are very frequent. Success of the treatment necessitates the adoption of a mature and realistic attitude by the local community and the avoidance of panic, moral condemnation, and discrimination. Facilities for vocational training and sometimes the provision of sheltered work opportunities are useful in rehabilitation and help to prevent relapse. It is also suggested that there is evidence of significant alienation among a group. One must look at the possible use of drugs in that group. Thank you very much.